Hello, it's CJ. Are you getting ready to have a baby and literally everybody keeps telling you how painful it's going to be? Unfortunately, they're not wrong. Giving birth does hurt. The good news is everybody's got a different level of pain tolerance and no two deliveries are the same. There are a number of different ways that your pain can be controlled in labor and there is no need for you to suffer. Today I'm going to talk about the four most popular forms of pain management in labor, and I'll let you know the advantages and disadvantages associated with each method. The first one is natural or unmedicated childbirth. These mamas choose to use relaxation techniques, a nice warm shower, a bath. They may walk, they may sit on the ball. They may use guided imagery. They will definitely use breathing techniques to deal with those contractions as well as the delivery. The advantage, recovery time is almost instant. The disadvantage, you will feel those contractions and it will be very uncomfortable. The second form is IV medication use. These are medications, narcotics, that are given to you through an IV. They do not make the pain go away, but they do make you stop caring about it. The advantage, you will get about 1 to 2 hours of good relief. The disadvantage, this medication does cross through the placenta and gets into the baby, so the timing of when you get the medication is really, really important. The third one is nitrous oxide, also known as laughing gas. The advantage to nitrous oxide, it is self-administered and it does not affect the baby. Disadvantage, nitrous oxide is not available at all facilities, so if that is something you're interested in, I encourage you to contact your birth center to see if that will be available. The fourth form of pain management, the most effective form, is the epidural. An epidural is a tiny tube that is placed in your back. It is done by an anesthesiologist or somebody who has been specially trained in epidural placement. A small amount of medication is infused through that tube, which will bathe your nerves, making the vast majority of your pain disappear. The advantage, about 90% of patients report effective pain relief, and it does not affect the baby at all. The disadvantage, sometimes the epidural will only affect one side. You may have a decrease in your blood pressure, which can be readily fixed by the physician. About 2 to 3% of patients will develop a headache after you have the epidural. Unfortunately, there are some people who are not candidates for epidurals. If you have a problem with bleeding, if your platelet count is really low, or if you have a history of certain back surgeries. So if you have had back surgery in the past, I encourage you during your pregnancy, get a copy of that operative report, make an appointment for a consultation with an anesthesiologist to make sure that you are in fact a candidate for the epidural. So to my mamas who've given birth in the past, what worked best for you for pain management? For me, honestly, it was the breathing techniques. I hope you'll leave those suggestions in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button.
You're still here. Thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.